How do cold abscesses appear in bone TB cases? Have you ever wondered how cold abscesses form in cases of bone tuberculosis? This is a fascinating yet complex topic. In bone tuberculosis, which is a form of the disease affecting the bones, cold abscesses can develop as a notable feature, especially in spinal tuberculosis. These abscesses are essentially collections of pus caused by the infection, but they are different from typical abscesses. Unlike regular abscesses, cold abscesses do not show the usual signs of acute inflammation. You won't see severe pain, redness, warmth, or marked tenderness, which is why they are referred to as cold. The process begins when Mycobacterium tuberculosis, the bacteria responsible for tuberculosis, spreads from the lungs or lymph nodes into the bones through the bloodstream. In the spine, the infection often starts in the vertebral bodies, which have a rich blood supply. As the bacteria invade, they gradually destroy bone and surrounding tissues. This leads to a type of inflammation known as granulomatous inflammation and a specific kind of tissue death called caseous necrosis, which is common in tuberculosis. As the infection progresses, pus starts to accumulate beneath the ligaments and soft tissues surrounding the infected area. This accumulation results in large paraspinal collections that we identify as cold abscesses. One interesting aspect of these abscesses is that they can grow significantly without causing the severe pain typically associated with pus formation in other bacterial infections. This is largely due to the slow and insidious nature of tuberculosis. The body's immune response tends to wall off the bacteria in granulomas rather than triggering a strong acute inflammatory reaction. Because of this, patients may not feel intense discomfort, which can delay diagnosis. Cold abscesses in bone tuberculosis often appear as painless or minimally painful swellings near the infected bone or joint. Sometimes, they can cause stiffness or deformity, but you won't see the redness or heat that you would expect with hot abscesses. In cases of spinal tuberculosis, these abscesses can compress nearby nerves or the spinal cord. If left untreated, this can lead to neurological symptoms, including weakness or even paralysis. In summary, cold abscesses in bone tuberculosis are formed as a result of pus accumulation from a slowly progressive infection. They arise when the tuberculosis bacteria spread to bone tissue, leading to caseous necrosis and abscess formation without the typical signs of acute inflammation. This unique clinical presentation is a hallmark of bone tuberculosis, particularly in the spine, and highlights the importance of careful medical evaluation and treatment to prevent serious complications. Always consult a healthcare professional for personalized medical advice.